In hematology, we oftentimes encounter problems where we see a decrease in platelet value. And in those problems, so our first break-off point in low platelets is looking at the peripheral smear. So if the peripheral smear is abnormal, and by abnormal I mean there are schistocytes, or the peripheral smear is normal. So I'm going to first examine the case where there are schistocytes on the peripheral smear in the case of low platelets. So when you have schistocytes on the peripheral smear, you then look at the PT and PTT. If the PT and PTT are increased, you think DIC. If the PT and PTT are normal, you think HUS and TTP. Now, I know you're thinking, well, isn't there D-dimer, fibrinogen, fibrin split products? But it depends on where you are in the evolution of the disease. There are different levels of fibrinogen where it could be elevated or severely decreased, but you're always going to have an elevated PT and PTT in DIC. So, as far as treatment goes, you're going to treat this with fresh frozen plasma or some kind of transfusion if the platelet count drops to really low. But in the case of HUS or TTP, you're just going to do supportive measures. You're not going to transfuse. So in the cases where you have a normal peripheral smear, you're going to look at whether the PTT is normal or not. So if the PTT is elevated and you have an increase in the bleeding time, you think von Willebrand's disease. If there are no other abnormal lab values, you think ITP. Now I want to point out a couple of things. Number one, when I started out with low platelets, von Willebrand's disease has a decrease in platelets, but the decrease in platelets is close to normal. So another thing I want to point out is, and let me just write platelets close to normal, that we're considering a case of a menstruating female. It could be a male or a menstruating female. If a woman is pregnant, the presumptive diagnosis changes, and I'm going to discuss that in a future video. But for now, we're assuming the typical example is a menstruating female who has heavy periods. And in the case of ITP, the presentation is petechiae. In von Willebrand's, the presentation is much worse. So I'm just going to write here mild petechiae. Presentation is mild. As for the treatment, Von Willebrand's disease, you start with DDAVP or desmopressin, and if that doesn't work, you try transfusing factor VIII. ITP, you would give steroids in a mild decrease. But if you really need to increase the platelet count, you consider IVIG, and in really severe cases, splenectomy.